No problem, sir.
Okay. Okay, give me the big glasses, please. But no shots of any of Margaret's face.
No problem.
What I want to do is just show people what it looks like. Okay, we're gonna do that local anesthetic. Today we're gonna treat this bunion, which is quite big, and there's a little bit of arthritis in the joint. And of course, before we do that, we've got to make sure the foot is frozen. So I'm just going to test to show our patient. This is what it feels like before anesthetic. You're feeling 10 out of 10, same as this foot. Here it's 10 out of 10, same thing. Here you're feeling 10 out of 10, 10 out of 10. As it gets numb, you'll tell me it's 8 out of 10, or 4 out of 10, or 1 out of 10, or if it's not frozen yet, 10 out of 10, because it does take a few minutes to freeze.
Okay.
Okay. Now the next thing I'm going to do is just draw a couple of landmarks for anesthesia. Hold your foot up for me. So that's where I'm going to freeze. Okay. You can relax. Okay, I'm just going to put a little betadine on your foot, which is a disinfectant. Turn your hip out a little bit. Perfect. Uses air pressure to push some freezing under the skin. It stings for a second. It feels like an elastic band snapping against your foot. I'm going to do it a few times. That way you don't feel the needle as it punctures the skin. You will feel a little burning sensation. Okay, I'm going to freeze the nerve behind the ankle. You'll feel a little, let me tilt you back just a bit. Is that better? Mm-hmm. You'll feel a little burning sensation, Margaret. Sometimes if I get real close to the nerve, you feel something electric. If you do, just tell me and I'll ease off. Okay. Go just anterior or in front of and posterior to behind the nerve. That's a posterior tibial nerve. Now we're going to do another spot. This is for the saphenous nerve and the medial ankle. A little burning, okay? Do one more pop. This one is for the deep. Okay. Margaret is an old pro. We did her other foot a few years ago. little extra in. What'd you feel?
Yeah.
Felt something?
Yeah.
Good. I mean, not good that it hurt, but good that means we're getting it.
Yeah, I felt that electric.
Okay, good. That means we're getting what we need to get. Now we're going to give that a minute or two to freeze, and in the meantime, I'm going to draw some lines on your foot, which is my road map. It shows me my landmarks. I'm going to just put a little bit more disinfectant on your foot first. Did you have previous surgery on this foot?
Yeah, I did have something about 30 odd years ago.
Yeah, I can see the scar
Yeah.
right there. It goes from here all the way up here. We're going to be doing two very small openings in the skin instead of one big, really long one, which is very traumatic. That explains why you have the arthritis. This is the plantar medial cortex that I'm palpating or feeling here. You can really see the scar from the previous surgery. That's just my pen you're feeling. We like patients to know what's going on so there's no surprises. That's my dorsolateral cortex. That's the dorsal-medial cortex approximately. And the osteotomy, or the bone cut, is a V-shaped cut, which is going to look something like this. And it's going to go right across. I'm just going to indicate where the joint is. These are not incisions, these are just landmarks. And I'm going to indicate where the long extensor tendon is. You okay, Margaret?
Mm-hmm.
This represents the extensor tendon, which we will avoid as much as possible. Now it may be starting to freeze. It does take a few minutes. So we're going to just compare. This is 10 on this foot. What's this?
Maybe a 5.
Good, we're getting there already. This is 10. What's this? Let's do it again. Anything? Good, that's a 0. Okay, this is 10. What's this?
2.
We're getting there. One more. This is 10. What's this?
1.
Wow, you're doing great. Okay, we're going to give it a couple more minutes to freeze, and then we'll come back.